Dr. Lindsey and Wendy here. This is a brief video, and it's focused on one of our hair greed patients, and it's let's call it good advice from a hair transplant patient. And so this character is about 38 years old, and we've done 3 FUE cases on him over the years, and he came back in with some hair greed yesterday. And look at this mop of hair. I mean, there's hair everywhere on this guy. And first of all, why do you want to do FUE? He wears his hair long. He's like Keith Partridge or something from the 1970s. And then, but he's got fantastic hair. And sure enough, it's been a few years since we saw him, and he's got a couple little spots that he wants to whittle away at. And I don't disagree with him. His hair loss has gotten a little thin as you work back towards his part line and behind what we did before. So look at his brief video. So Steve, you're how old did you say we're 38?
I'm 38.
38. And we've done 3 FUE cases on him. Man, that's a mop of hair. Take your hand out of your hair one time. Look at that. Look at that mop of hair. She didn't even do Christmas. All right, now put your hands back in there. And I won't get you. No, I don't. I'll cut that out. So that looks awesome, but like all you guys, you got a little hair greed, and you want a little bit more put right at the hairline. And
Always
I can
have.
see that.
Always have.
And we were just talking a minute ago about kind of the role of what you've learned in your hair transplant education over the past 7 or 8 years.
Well, yeah, I mean, I've been losing my hair since I was 18, and I've been on Propecia or Avodart since then. And, you know, hair loss is a progressive thing. Even with all this stuff, it's progressive. So you need to stay on top of it. You need to know that if you get it done, chances are really good you're going to have to get more sessions done at some point. And also, if you have hair like mine and you're just sort of have hair greed, that hair greed is never ever going to end. And you lose a little bit more hair, you're probably going to want to come back and get it fixed. So just realize it's a lifelong journey, and as long as you accept that from the beginning, you're set.
Was that pretty blunt with you? And
yeah, you were real blunt with me, and I'm always blunt with myself, and you need to be blunt doing this because it's a serious thing, and it's permanent, and it's ongoing. So bluntness is the way to go. You need to know the facts, and you need to be able to accept them.
All right, man. Thanks for coming in.
Yeah.
I mean, I guess that's awesome.
And that's it. Yeah, he looks great, and he, you know, his video, what he's talking about is so real.
Yeah. So issue 1 is that hair greed never goes away, right?
No.
And he's pretty blunt about it. You know, no matter how much you think you're going to be happy with.
You still want more.
With a Corvette, you're going to want a Corvette with bigger wheels, or a truck with bigger tires, or something like that, or a denser hairline. What else does he talk about?
You know, the ongoing process.
Yeah, hair loss goes on forever. It stops when you die. Now, you can get an educated guess based on what your family is. I mean, this character's got good family genes. He's probably not going to lose a whole lot more, but he's has the potential to lose a lot more. Fortunately, he's got a lot to work with. But if you've got bad hair genes, and you're a young guy, you've got to plan for the worst and get a mature hairline. And then the third thing is that he liked that we were blunt with him, and he's blunt with his own self-assessment. So many times we see guys that come in here with, just yesterday, a kid that came in that was worried about us shaving his crown so we could do his transplant. We shaved it off, and it looked like a tenth of a triple. You know, it was just
it was almost nothing. But he still says, "Am I going to be able to cover it?" And I'm telling him, "There wasn't much there. And it looks better now with the little, grafts in there than what he had before."
So take heed from our patient Stephen, and if we can help you, please give us a call. Thanks.